Good day, ladies and gentlemen. Hello, dear friends. My name is Vasyly Rohovyy. I am the hand transplant patient and the founder of the Voice of VCA Patients from Innsbruck, Austria. Welcome to the interview. Today, our guest is Mr. Leszek Opoka, the first unilateral hand transplant recipient from Poland. In April 2006, Mr. Opoka underwent the unilateral hand transplantation at St. Jadwiga Hospital in the city of Trzebnica. Today, Mr. Opoka shares with us his personal journey of finding hope, recovery, and living a new life with a new hand. Many people who lost a hand are very interested in learning what it's like to live with one own hand and the other transplanted one. Let us find out together. Hello, Leszek. Nice to see you.
Hello Vasyly, glad to see you.
Leszek, according to our tradition, could you start talking about your life before that black day in your life? How old were you when you suffered that cruel blow of fate?
So I was 21, a final year student at secondary school. During the summer holidays in 1993, I was working on finishing the construction of our home, more or less as a helper and machine operator for a carpenter. One Saturday, on my day off, I had a great idea. To build a box for VHS cassettes. I decided to do it myself. It was probably the most stupid idea I could have had for my day off. That day, I lost my right forearm.
Leszek, you lived without one hand many years. Do you remember that day in your life when you learned about the hand transplantation? What did you do after that?
At the end of the 90s, I remember, I was watching the TV news and oh my god, the first hand transplant in the world. A few days later, I called the most advanced and famous microsurgery center, my beloved Transplantation Hospital, and talked with Dr. Adam Dimineshewicz. I remember, I was so emotional at that moment. I had been waiting for this day for so long, but at the same time, it was such a huge surprise for me.
So to say, you started acting on your own. Leszek, I would also like to ask you about your experience with prosthesis. What did you think about when you saw them for the first time? Please.
I was 21 years old. I visited an orthopedic center, and I saw a forest of artificial arms and legs down. It was a nightmare. I was deeply shocked. I didn't want my hand to look like that. It was a dark time for me.
Leszek, those years after the incident, without any hope of getting the hand back, what were they like for you? Were they empty years of despair and emptiness, or were you able to come to terms with the lost? Could you describe those years for our viewers, please?
One spent a few years working at a large TV and household appliances center in my city. Then I became the owner of a small internet cafe called Dune, of course, in memory of the best sci-fi story, Dune by Frank Herbert. From time to time, I sent emails to the hospital. Meanwhile, time flew by, and I slowly lost hope. But then, after 2000, I received a letter asking me to visit the hospital. It turned out that all the volunteers had been called in for a small examination, to have some blood taken and things like that. The hospital had received approval for this small experiment.
Leszek, could you please tell our viewers about your first meeting with the surgeons at St. Jadwiga Hospital? What was their reaction to your wish or decision to undergo the hand transplantation? Tell us please about this.
I had the honor of meeting the famous Professor Richard Kachiba, one of the pioneers of hand replantation, and Dr. Adam Dimineshewicz. I remember they asked me, "Are you crazy?" There was a lot of risk, nobody knew how it would end. But I was determined. So Professor Kachiba said to Dr. Dimaneshevich, okay, measure the rest of his arm and put him on the list of patients. And then I received a list of tests to check my health the size of a small old-school phone book.
Leszek, the transplant day is unforgettable for every one of us. Could you tell our viewers about the day in your life when you received a phone call from the clinic that an appropriate donor was found for you? What did you think about at that moment? Were you afraid of the upcoming surgery? Or what did you feel? Could you tell please about this?
A long time ago, in a galaxy far, far away in a small city, late at night on April 1st, 2006, by the way, April 1st is International Joke Day. The phone rang. It was to Zebnica Hospital. How do you feel? Are you healthy? Are your teeth fine? I held the phone in my left hand. Both hands were shaking. I was panicking. I was stuttering. And then I heard, "We have an arm to transplant. Nobody is ready for this."
Leszek, today you have two hands. One is your own hand and the other is the transplanted one. Could you describe the difference between your hands? How do you feel about them?
They're almost the same. Of course, the transplanted one is less functional. It depends, on the time between the accident and the transplant, and on the extent of the damage to the arm. I have partial feeling in the hand. There are some things I can do, and some things I can't.
Leszek, as you probably know, patients with solid organ transplantation have their own societies, communities, and only we, VCA patients, have nothing at all. How do you think would we, VCA patients, hand transplant patients, face transplant patients, benefit from having our own community where we could share our hopes and dreams, discuss our problems, and so on? Could you tell your opinion on this matter, please?
Yes, without a doubt. I was the first, and I had nobody to talk to about my problems and everything I was going through. At that time, knowledge about hand transplantation was very limited. I had nobody to share my experience with, so I had to deal with it mostly alone. Blood, sweat and tears.
Leszek, 20 years have already passed since your surgery. Could you tell our viewers, please, how has the hand transplantation changed your life for better and for worse?
My grandmother, a long time ago, asked me, "Are you afraid that when you sleep, the hand will suffocate you?" It's nice to be able to do many things that before were only dreams. After 20 years, I still enjoy these things. Today, many of them are just part of my everyday life, but I remember when they were only dreams.
Leszek, it would be very interesting to learn if you had any learning materials, including side effects of immunosuppression therapy or side effects of additional medications you have to take after the surgery, transplant experience of other hand transplant patients, maybe learning materials describing chronic rejection, acute rejections with pictures. Would it have been easier for you to go through your transplant journey again? What is your point of view on this matter? Do the field need such learning materials? What do you think about this?
Yes, definitely. If I had had this kind of information before my transplant about immunosuppression, possible side effects, different types of rejection, and real experiences from other patients and doctors, it would have been much easier for me. Before the surgery, I simply didn't know what to expect. There were so many things I couldn't even imagine. Having this information would have helped me to be much better prepared.
Leszek, what could you tell patients considering the hand transplantation as an alternative treatment? What advice would you give them to avoid failure or disappointment after the surgery?
I know it's easy to say many things when you are doing better, but seriously, you need a lot of luck. Things don't always happen as planned. You have to be ready for unexpected turns. After transplantation, many things can happen that you could never imagine before. So you need patience, strength and, yes, a lot of luck.
Leszek, I appreciate very much your time and your support of our patient initiative Raise Awareness About VCA. Thank you very much for your participation. That was a very honest and open discussion. I'm sure it helps many people to make right decision. I wish you all the best and shake hands with you.
Thanks a lot, Vasyly, for your work. Indeed, every VCA journey is unique. Preparation and support are very important, but fate and timing also play a role. As patients, we live somewhere between hope and uncertainty. That's why sharing our stories and experiences is so important.
Goodbye, friend.